So hello friends and welcome to the short revision series of part second for Neet PG 2022. So first of all I will be starting with the personality disorders. So there are three types: cluster A, B and C. So we will be talking about cluster A. These are people with odd, weird and eccentric. They are more classified into paranoid. Paranoids are like suspicious and distrustful. Now schizoid, they are loner and detached. And schizotypal, they are odd, they have odd thoughts, magical thinkings and beliefs. So these are included in cluster A type personality disorders. Now cluster B type personality disorders, they're dramatic and they are emotional, like antisocial. They do illegal activities and violation of others' rights. Now borderline, they are of labile mood, they do self-harm and emptiness. Now stronic are dramatic and superficial and attention seeking. These are stronic. And narcissistic, like grandiosity, they have now. So these are included in cluster B, dramatic and emotional. Now cluster C type, they are anxious, fearful and introvert. So avoidant, they are avoidance due to fear of any criticism or rejection. Now dependent are submissive, clingy or needs to be taken care of. Now these people are dependent. Now obsessive and obsessive compulsive, they are rigid and controlling and perfectionist. So these are anxious, fearful, introvert. These are cluster C type personality disorders. Now the types of vaccines, these are very important and very much asked. So first of all, toxoid and protein involve diphtheria, tetanus, acellular pertussis, anthrax and influenza subunit. Now polysaccharides are pneumococcus, meningococcus and HIB, like Haemophilus influenza B and typhoid VI. Now glycoconjugate, this is HIB and like Haemophilus influenza, like pneumococcus and meningococcus vaccine. These are polysaccharide as well as glycoconjugate also. Now recombinant vaccines are hepatitis V and Lyme's disease, HPV and cholera toxin B. These are recombinant type of vaccines. Now collagens, which are present collagen proteins in the body. What type of collagen what kind of work? So 1, 2, 3, 5 and 11, these are they form fibrils. So the fibrils. Now type 4, 8 and 10, remember, they form sheet or meshwork kind of things. Now type 6, 7, 9, 12, 14 and 18, they do linking role and anchoring role in the body. And type 13 and 17, they are transmembrane proteins. So this is very important. These and these and these are asked, so try to remember this. Now single unit smooth muscle cells are present in which of the following? Digestive tract and urinary tract. In the urinary tract, they are present in the ureter and the bladder, ureterus and blood vessels, except the large elastic arteries. Because now multiple unit smooth muscle cells and large elastic arteries there: iris, trachea and bronchi, erector pylorus and ductus deferens. So this is very important. These are also asked, so remember these. See, the large elastic have multiple unit smooth muscle cells and not single unit. Okay, other blood vessels have single unit smooth muscle cells. Now transaction of vagus nerve at different levels. So first of all, vagal nerve, if transacted, if intact, what happens? Injury to above the levels of the pons, normal breathing with loss of voluntary control. And if the vagus nerve is cut, slow and deep breathing will be there. This is above the level of pons. Now mid pons, There will be, if vagal nerve is intact, there will be slow and deep breathing. And now if the vagal nerve is cut, there is apneosis. Now if the transaction is, the injury is between the pons and the medulla, and the vagal nerve is intact, there is irregular medullary breathing. And if the vagal nerve is cut, then also irregular medullary breathing is present. Now if there is a injury lower, below the level of medulla, and if the vagal nerve is intact, then apnea will be there, and if vagal nerve is cut, then also apnea will be there. This is very much asked, and these are framed in the clinical type of questions also. So try to remember this, then you will be able to answer the clinical questions also. Okay, so next part will be coming soon. Stay tuned, and you can comment below if you have any suggestions or any topics in your mind.